Navigating the world of health insurance can often feel like deciphering a complex secret code, especially when terms like PPO and HMO start getting thrown around. Yet, understanding your health insurance isn't just about paperwork. It's about ensuring you and your loved ones have access to the care you need when you need it, without facing unexpected financial burdens. Choosing the right plan is a crucial decision that directly impacts your ability to access doctors, specialists, and hospitals, ultimately affecting your health and financial well-being. It's no wonder so many people feel overwhelmed by the sheer number of options and the subtle yet significant differences between them. That common confusion is exactly what we're here to clear up today. In this comprehensive tutorial, we're going to demystify two of the most prevalent types of health insurance plans: PPO, which stands for Preferred Provider Organization, and HMO, or Health Maintenance Organization. We'll break down exactly what each of these acronyms means and, more importantly, highlight the key structural differences that set them apart. We'll dive deep into the factors you should carefully consider when trying to decide which plan aligns best with your unique healthcare needs and lifestyle. To make these concepts truly concrete, we'll walk through practical examples that illustrate how each plan operates in real-world scenarios, helping you visualize the impact on your wallet and your access to care. Why is this information so incredibly useful and important for you right now? Simply put, understanding PPO and HMO plans empowers you to make an informed decision when it comes to your health insurance. This knowledge is your shield against unexpected costs and the frustration that comes with navigating a healthcare system you don't fully comprehend. It's about optimizing your access to necessary medical services and making sound financial plans for your future healthcare needs. Ultimately, the choice you make directly impacts your personal health outcomes and your financial security. Don't let confusion lead to costly mistakes or compromises on your well-being. As we go through this, you might find yourself asking some common questions. For instance, many people wonder, which plan is cheaper? The answer, as you'll soon discover, varies significantly based on your priorities and how you utilize healthcare services. We'll explore the cost variations, including premiums, deductibles, and co-pays for both plan types. Another frequent query is, do I need a referral to see a specialist? This is a critical distinction between PPOs and HMOs, and will clearly outline the referral requirements for each. Finally, the question, can I choose any doctor, often comes up, and we'll delve into the network flexibility that characterizes these plans. It's vital to set the stage with one fundamental truth. There is no universal one-size-fits-all answer when it comes to health insurance. What works perfectly for one person might be entirely unsuitable for another. Our goal here isn't to tell you which plan is inherently better, but rather to equip you with the knowledge to understand your own individual needs and priorities, and then match them with the plan that serves you best. We encourage you to engage actively with this information. Think about your own healthcare history, your preferences, and your budget as we explore these options together. By the end of this discussion, you'll be much more confident in making a choice that supports your health and financial well-being. Before we continue, subscribe to the channel and tell us in the comments where you are watching from. Now let's dive into the specifics of a PPO, or Preferred Provider Organization, to understand how it operates and when it might be the ideal choice for your healthcare needs. A PPO plan gets its name from its network of preferred providers, doctors, hospitals, and other healthcare professionals who have agreed to provide services to plan members at negotiated, discounted rates. When you receive care from one of these in-network providers, your costs are typically lower. However, a defining characteristic of PPOs is their flexibility. You also have the option to see out-of-network providers, meaning those who don't have a contract with your insurance company. While this offers greater choice, it usually comes with a higher out-of-pocket cost. Critically, with a PPO, you generally don't need a referral from a primary care physician or PCP to see a specialist, giving you more direct access to the care you seek. Let's break down the key characteristics of PPO plans further. First, regarding their network structure, PPOs typically boast larger networks compared to other plan types, offering a broader selection of doctors and facilities. The significant advantage, as mentioned, is the ability to go out of network, though you'll pay more for that privilege. This flexibility extends to referrals. If you need to see a dermatologist for a skin issue or an orthopedic surgeon for a joint problem, you can usually schedule an appointment directly without first visiting your PCP for a referral. This streamlines the process, especially for those who frequently require specialized care. When it comes to cost structure, PPOs have distinct features. Generally, they come with higher monthly premiums compared to HMOs. This higher upfront cost is often the trade-off for the increased flexibility. You'll also encounter deductibles, which are the amounts you must pay out of pocket for covered healthcare services before your insurance plan starts to pay. For example, if your deductible is $1,000, you'll pay the first $1,000 of covered medical expenses yourself before your insurance kicks in. After meeting your deductible, you'll typically pay co-payments or co-insurance. A co-payment is a fixed dollar amount you pay for a service, like $30 for a doctor's visit. Co-insurance is a percentage of the cost you pay for a service, such as 20%. These amounts usually differ depending on whether you use an in-network or out-of-network provider, with out-of-network services almost always costing you more. However, PPOs also feature out-of-pocket maximums, which are the most you'll have to pay for covered services in a plan year. Once you hit this limit, your insurance plan pays 100% of your covered medical expenses for the rest of the year, offering a crucial financial safety net. The advantages of PPO plans are quite compelling for many. The paramount benefit is the freedom to choose almost any doctor or specialist you prefer, even if they are outside your plan's network, albeit at a higher cost. This level of choice is invaluable for those who have established relationships with specific providers or who live in areas with limited in-network options. The absence of referral requirements also simplifies access to specialized care, saving time and potential delays. PPOs are particularly beneficial for individuals who travel frequently or desire more control over their healthcare providers, as they offer broader coverage options across different geographic locations. However, PPOs do come with their drawbacks. The most significant is often the higher monthly premiums, which can be a substantial financial commitment. If you frequently use out-of-network providers, your out-of-pocket costs can accumulate quickly, potentially negating some of the perceived benefits of flexibility. Furthermore, while the freedom is great, it often means more administrative responsibility for you, especially when dealing with out-of-network claims, which may require you to submit paperwork for reimbursement. So, who is a PPO best for? Practically speaking, a PPO is an excellent fit for individuals who prioritize choice and flexibility in their doctors and specialists. If you have pre-existing conditions that require you to see specific providers, or if you frequently consult specialists, the direct access a PPO offers can be invaluable. It's also ideal for those who are willing to pay higher monthly premiums in exchange for greater freedom and less red tape. Lastly, if your lifestyle involves frequent travel, a PPO's broader coverage can provide peace of mind that you'll have access to care wherever you go. You might be wondering, what if my preferred doctor isn't in the PPO network? In that case, you can still see them, but your plan will likely cover a smaller percentage of the cost and you'll pay a higher co-insurance or co-payment. It's crucial to understand your out-of-network benefits. Another common question is, how do I know if a service is covered by my PPO? Always emphasize checking your plan documents, specifically the summary of benefits and coverage, or calling your insurance provider directly. This proactive step can prevent costly surprises. Now let's shift our focus to the other major player in health insurance landscapes, the HMO, or Health Maintenance Organization. The name itself, Health Maintenance Organization, gives us a strong clue about its philosophy. HMOs are designed to provide coordinated care with a strong emphasis on maintaining your health and preventing illness, typically within a specific, more tightly controlled network of doctors and hospitals. The central figure in an HMO plan is your primary care physician, or PCP, who acts as a gatekeeper. This means your PCP manages all aspects of your healthcare, coordinating referrals to specialists and ensuring you receive integrated care. Understanding the key characteristics of HMO plans is vital for comparing them effectively. First, their network structure is generally more restricted than PPOs. You must choose doctors, hospitals, and other healthcare providers from within the HMO's specific network. If you seek care outside this network, except in true emergencies, your plan typically will not cover the costs, leaving you responsible for the entire bill. This brings us to referrals. A PCP referral is almost always required before you can see a specialist. Your PCP will assess your condition, and if they deem a specialist necessary, they will provide the referral, directing you to an in-network expert. This system ensures coordinated care, but can sometimes feel like an extra step in accessing specialized services. From a cost perspective, HMOs offer a different financial profile. They typically feature lower monthly premiums compared to PPOs, making them a more affordable option for many individuals and families. Deductibles in HMO plans are often lower, and in some cases, there might be no deductible at all, meaning your insurance coverage begins almost immediately after paying your premium. When you receive in-network services, you'll usually pay a predictable copayment, which is a fixed amount for each visit or service. These copayments are generally lower than those found in PPO plans. However, it's crucial to remember that for out-of-network care, HMOs provide very limited or no coverage, except for genuine emergency situations. This strict network adherence is how they manage to keep premiums down. The advantages of HMO plans are clear, particularly for those prioritizing cost efficiency and a structured approach to healthcare. The lower monthly premiums are a significant draw, making quality health insurance more accessible. Furthermore, the out-of-pocket costs for in-network services are generally quite predictable and lower than those in PPO plans. The coordinated care model, with a PCP overseeing your health, can be a major benefit, especially for individuals managing chronic conditions, as it ensures a holistic and consistent approach to treatment. Finally, HMOs typically involve less paperwork for the member, as the plan's network providers handle most of the claims processing directly. However, HMOs also have their disadvantages. The most prominent is the limited choice of doctors and hospitals. If you have a specific specialist you prefer who isn't in the HMO's network, you won't be able to see them without paying the full cost yourself. The requirement for referrals to see specialists can also be a point of frustration for some, potentially delaying access to care. This gatekeeper model, while beneficial for coordination, might feel restrictive if you prefer direct access. The lack of coverage for out-of-network care outside of emergencies means that if you accidentally or intentionally seek care outside your network, you could face unexpectedly high costs. Lastly, HMOs offer less flexibility if you move to a new area or need care while traveling, as their networks are geographically specific. So who is an HMO best for? Practically speaking, an HMO is an excellent choice for individuals who prioritize lower monthly costs and appreciate predictable expenses. If you're comfortable choosing a PCP and relying on them for referrals to specialists, and you prefer a more structured, coordinated approach to your healthcare, an HMO can be very effective. It's also ideal for those who primarily seek care within their local area and don't anticipate needing frequent out-of-network services. For example, young, healthy individuals who rarely see a doctor might find an HMO's affordability and simplicity very appealing. You might be asking, what if I need to see a specialist urgently and can't get a referral right away? In emergency situations, HMOs, like all health plans, are legally required to cover emergency care, regardless of whether the facility is in-network. However, for non-emergency urgent care, you would still typically need that PCP referral. Another common question is, can I change my PCP if I'm not happy? Yes, you absolutely can. HMOs have a process for changing your primary care physician, usually by contacting member services, ensuring you maintain a good relationship with your gatekeeper. Let's quickly summarize the key differences to solidify your understanding. PPOs offer greater flexibility in choosing doctors, including out-of-network options, and generally don't require referrals for specialists. However, they come with higher monthly premiums and potentially higher out-of-pocket costs if you utilize out-of-network providers. HMOs, on the other hand, boast lower monthly premiums and predictable, lower out-of-pocket costs for in-network services. Their trade-off is a restricted network and the mandatory requirement for PCP referrals to see specialists, with no coverage for out-of-network care except in emergencies. When making your final decision, consider your current health needs and try to anticipate any future needs. Are you planning a family? Do you have a chronic condition? Evaluate your budget carefully. Are you willing to pay a higher premium for more choice, or do you prefer lower monthly costs and a more structured approach? Always check if your preferred doctors and specialists are within the plan's network, regardless of whether you're considering a PPO or HMO. Most importantly, read the plan's summary of benefits and coverage carefully. This document is your roadmap to understanding what's covered and what your financial responsibilities will be. As you move forward, don't hesitate to consult with a benefits administrator at your workplace or an independent insurance agent. They can provide personalized advice based on your specific situation. Utilize online comparison tools provided by employers or government insurance exchanges. These resources are designed to help you weigh your options side by side. Remember, understanding these plans empowers you to make better health and financial decisions for yourself and your family. We encourage you to leave any questions you have in the comments below and share your own experiences with PPO or HMO plans. Your insights can help others on their journey to informed healthcare choices.